How is XDR-TB related to MDR-TB? Imagine a battle between bacteria and medicine, where the bacteria keep evolving to resist treatment. That's what happens with tuberculosis, a bacterial infection that primarily affects the lungs. When the bacteria become resistant to the usual medicines, it's called drug-resistant tuberculosis. Among these, multi-drug-resistant tuberculosis is a serious form. It occurs when the bacteria resist at least the two most powerful first-line drugs, isoniazid and rifampicin. This makes treatment more complicated and longer than normal tuberculosis. Now, within drug-resistant tuberculosis, there is an even more resistant form called extensively drug-resistant tuberculosis. XDR-TB is a subset of MDR-TB, meaning all cases of XDR-TB are also MDR-TB, but not all MDR-TB cases are XDR-TB. The key difference is that XDR-TB bacteria resist not only the first-line drugs but also at least one fluoroquinolone, which is a second-line antibiotic, and at least one of the three main second-line injectable drugs, like capromycin, kanamycin, or amikacin. Some definitions also include resistance to other important drugs like bedaquiline or linezolid. This broader resistance makes XDR-TB much harder to treat. While MDR-TB already requires longer and more complex treatment, XDR-TB often needs even more extended therapy with fewer effective drugs available. The success rate drops, and the risk of treatment failure or death increases. It's also more toxic because the drugs used tend to have more side effects. Most cases of XDR-TB develop from inadequate or mismanaged treatment of MDR-TB. If the initial treatment isn't properly followed, or if the bacteria are exposed to incomplete therapy, they can develop resistance to additional drugs. About 9.6% of MDR-TB cases worldwide progress to XDR-TB, which highlights how important proper treatment and early diagnosis are. Detecting XDR-TB requires specialized testing beyond the usual drug susceptibility tests. Molecular tests can identify resistance to second-line drugs quickly, which is crucial for starting the right treatment early. The transmission risk of XDR-TB is similar to other forms of tuberculosis, meaning it can spread in communities if not properly controlled. Clinically, XDR-TB can cause more severe lung damage, with larger cavities visible on scans, reflecting its aggressive nature. Because of its resistance profile, managing XDR-TB is more challenging, requiring careful medical oversight and often more toxic medications. Preventing its spread depends on early diagnosis, proper treatment of MDR-TB, and strict infection control measures. In summary, XDR-TB is a more resistant and dangerous form of MDR-TB. It develops from additional resistance to key second-line drugs, making treatment more difficult and increasing the risk of poor outcomes. Preventing its spread relies on good medical management of all tuberculosis cases and early detection. Always consult healthcare professionals for personalized advice and treatment options.